These are what we call complete dentures. And these dentures are what people think of when they hear the term dentures. It's an acrylic set of teeth that go in and out of the mouth. The maxillary denture, or the top one, suctions against the roof of the mouth. That's how it stays in. The bottom one doesn't really suction against the ridge. It sits on the ridge. It has some minimal retention from the flanges here, but in general, it's hard to keep a lower one still. These are what we call overdentures. They get their name because they're a denture that goes over something. And in this case, the denture goes over dental implants. These metal gray titanium posts are dental implants. And the dental implants are placed in the patient's bone. And on top of that, an abutment is placed. That's the gold piece that you see here. Think of the gold and its reciprocating part as being a button. And that's essentially what it is. It allows the denture to snap onto the implants. And you can hear it snap into place. At that point, I can usually grab a hold of the denture and wiggle, and it doesn't move. The patient, it's stuck in the patient's mouth. Maxillary overdenture, the difference is gravity works against us, and we need more than 2 implants. We need at least 4 implants. When we have 4 implants, we can take the palate out of the denture. So we compare the two. A conventional denture has a palate. An overdenture on 4 implants for the maxillary or the top arch has no palate. And you can automatically tell most of the time which you'd rather have in the mouth. This is larger, but it has to be in order to create the suction. Lastly, in terms of fixed options, you have what we call hybrid prostheses. And a hybrid gets its name because it is essentially a bridge. Many patients are familiar with bridges. They have a bridge from tooth to tooth. Well, this is a bridge from implant to implant to implant to implant. But unlike normal bridges that we often have made out of ceramic, this one is made out of acrylic, very similar to a denture. It allows us to repair it easier if we ever had to. It allows us to keep it clean. It allows for a few things. But once you have teeth such as this screwed in place, it stays in the patient's mouth.